Good morning. Welcome to Healthcare Half Hour. Welcome to this month's Healthcare Half Hour presented by us here at North Carolina Health News. This month, we are going to discuss one of the favorite topics in North Carolina, Medicaid expansion. It's a policy discussion, debate, struggle, however you want to just characterize it, that's been ongoing for a decade now. And the battles over this policy have generated multiple campaigns, protests, a state budget stalemate in 2019, and frustration on both sides of the political aisle. So, but in one part of the state, in Western North Carolina, multiple constituencies have come together and found a way to yes and on Medicaid expansion, despite their political differences. So out in Western North Carolina, people on the left and the right have found a way to agree on this policy, and we're going to dig into how these disparate groups found a way to get to yes. And we think that maybe this also can provide a model for how others can talk across political boundaries in order to reach common policy goals. So today we have here with us, Casey Cooper is the Chief Executive Officer of the Cherokee Indian Hospital Authority. Casey is a registered nurse, woohoo, nurses, and is a member of the Eastern Band of the Cherokee, and has been an early proponent of Medicaid expansion. And for the past, year or two, he's been traveling through Western counties, speaking to boards of commissioners and other public organizations about the benefits of expansion. We've also got with us Chris Cooper, who's another Cooper, who's a professor of political science and public affairs and the director of the Public Policy Institute at Western Carolina State University, Western Carolina University at Coolowee. His research and teaching focuses on state and local politics, North Carolina politics, elections, and Southern politics. And he's a frequent political commentator around the state. I'm sure you've seen his face and heard his name. And finally, we have joining us Senator Kevin Corbin. He's the North Carolina State Senator representing Cherokee, Clay, Graham, Hayward, Jackson, and Swain counties, so 6 counties in Western North Carolina. Before being elected to the state Senate, he spent 2 terms in the House of Representatives. And prior to his time in the state legislature, he was on the Macon County Board of Commissioners and the Macon County School Board for some 26 years. And then outside of elected office, Senator Corbin is the owner of 2 insurance agencies. So I want to welcome him. And before I want to get started, I want to remind folks that North Carolina Health News is the state's nonprofit newsroom dedicated to exploring the full range of healthcare issues and health policy issues. We're powered by you, our readers, and we really appreciate your donations and your support of our work. And a link to our donation page will be in the chat. And so with that, let's get to our conversation. And I'm going to start with Casey. You've been, give me a short, if you can do it briefly, a timeline of your involvement in helping folks get to yes.
So Medicaid expansion has been an interest to the tribe for a long time. So Rose, I really appreciate you inviting me to be a part of this conversation. So when the Affordable Care Act passed and Medicaid expansion became an option, Medicaid expansion was intended to bring great relief, to the uninsured population, but especially to the uninsured populations of American Indians and Alaska Natives. The Congress passed several amendments to the Social Security Act to guarantee 100% federal match for American Indians and Alaska Natives so that the states would not bear the burden of that cost. And this was an attempt by Congress to bring some much needed financial relief to the horribly underfunded Indian health system. So we've been engaged in these conversations for quite some time, and we became more engaged at the state level when the legislation passed the House a couple of years ago for, I think it was the Carolina CARES Act, because of the workforce requirements, which would be antithetical, if you will, to the federal government's trust responsibility to American Indians. So we initially became involved in the discussion when that act passed. But we became more involved about a year ago, I guess, somewhere around there, when actually it was after Senator Corbin had demonstrated a lot of leadership here in Western North Carolina and had demonstrated that Medicaid expansion doesn't have to be a partisan issue, that, out here in Western North Carolina, when in most counties, 1 out of 5 of us doesn't have health insurance. And as a matter of fact, there's a couple of counties out here where it's almost as high as 1 in 4 of us doesn't have health insurance. And, in small rural counties, we don't have the luxury of being separated from and, being void of empathy for the folks in our communities that don't have insurance, because they're family members, they're community members. We go to church with them. We rely on them for workforce. So we became engaged. I became engaged, and the tribe became more engaged, probably subsequent to Senator Corbin's leadership out here in the western part of the state. And we began just talking with some of our neighbors and neighboring counties, and that's kind of how the process began.
Mm-hmm. So, I think it's kind of interesting. Senator Corbin, how did you, where did you start on Medicaid expansion, and then how did you move from one place to the, or I'm guessing from one place to the other?
Right. So, good morning, Ann. How are you doing today?
Good, thanks. It's so good to see you.
Good. And I apologize for my voice. I'm a little under the weather today, but I'm not feeling great, but hopefully going to be all right. But we did not want to miss this. So, I think you mentioned in your intro that professionally what I do is health insurance. I do mostly health insurance, but we have 2 insurance agencies, one in upstate South Carolina, one in Western North Carolina. So, first of all, we see the coverage gap. People talk about the coverage gap and think about that as some term, some reference to some unknown people. I see those people every day. I deal with they're real people with with real names and real families and real situations. So first of all, working in the insurance business and working specifically in health insurance, I see the coverage gap where all the Anns and the Caseys out there all over the state of North Carolina are not covered because, one, I've given this example so many times and quoted, I think they probably even use this, but the single mom that has 2 kids, she makes $16 an hour, which is a decent wage. She makes works 30 hours a week because she has to spend a lot of time with her kids. That puts her at about $24,000 a year, which is a decent wage, but she doesn't make enough money to qualify for a tax credit to buy a policy under the Affordable Care Act. She makes too much money to have Medicaid. She has no health insurance whatsoever. So what does that person do? They come into my office and they give me their income, they give me their information. I put it in the computer, I log in and I give them their quote. And yes, ma'am, I can give you a policy. It's $600 a month or whatever it is. And she does what you just did and shakes her head and says, I can't afford that. I know she can't afford that. I'm not trying to sell it to her because there's no, how's she going to pay $600 a month when she's making $24,000 a year?
Right.
So she leaves my office and just does not have health insurance, and then she has a health problem, and she doesn't go get help because she doesn't have health insurance, can't afford the doctor's visits, can't afford the tests that might come from that visit, so that she goes without coverage, goes without care. So when does that person get care? Let's all think about that. That person gets care when it's an emergency, when they're bleeding, when something is broken, when something is really, really bad. So where do they go for that? They go to the emergency room. An emergency room visit, average emergency room visit is probably $3,000, maybe a little more than that.
Mhm.
Whereas the average visit to an urgent care center may be $150.
Mhm.
Instead of going to the urgent care center or going to their primary care doctor for $150, they go to an emergency room for $3,000.
Mhm.
In my way of thinking, how is that conservative politics? How is that conservative thinking when you're asking a certain segment of our population, a fairly significant segment of our population, to get health care in the most expensive way they could possibly get it? How is that, excuse me, conservative politics? I need to go to urgent care, by the way. So sorry about that. Casey, can you take me over at
We
Cherokee?
certainly can.
Right.
As long as you've got coverage, Senator, we'll take care of it.
I've got a fuel card, which brings up another. And so when real quickly, so when I go get coverage, when I go to Casey's hospital or I go to Angel Hospital in my hometown, I've got a Blue Cross Blue Shield card. That's the coverage I have. And I've said during this discussion, those hospital folks figuratively are going, yep, all right, good. Kevin's here. He's got health insurance. We're going to get our money. So how does that work? So I pay more for my health insurance because I've got it. I pay more for health insurance because the coverage is there and they're going to get their money. And the people who aren't covered, if they go to the emergency room, are going to get treated anyway, but they can't pay. So
Mhm.
I pay more for my health insurance. So it costs me extra money. So it's a long answer to a short question of why was I on board with this. I see it that it makes sense that we don't need 600,000 North Carolinians without coverage. It doesn't make moral sense. It doesn't make physical sense. It doesn't make insurance sense. It doesn't make any sense at all. So I've been on board with that for a couple of years, and fortunately have been able to talk some of my colleagues into agreeing with that.
So how do you do that, right? How do you do that? I think both you and Casey can talk a little bit to how you go about sort of convincing people who've been hearing, they get the political message, but they're not getting kind of the human message, the fiscal message, right? How do you make that case?
I'll defer to you. I'll answer after that, Ann, if it's okay.
What?
So Rose, do you want me to take that question then? I think
Why don't you start that? Yeah, Casey,
Sure.
because you had a great example.
So, I'm not saying this is the solution. I'll just share our experience. As we were talking with folks out here in the western part of the state, there were some things that became apparent to us. And the first thing is there was a lot of misinformation about it. There was a lot of misunderstanding. And number two, there was unfortunately a harmful narrative that we had to address. And I'll take the latter first. The harmful narrative, I think, just kind of organically grew out of the way this population was being defined. And in the early days, they were being defined as able-bodied, childless adults. Well, everything about that is negative. Everything about that dehumanizes this whole population of people. And it creates a narrative that these are lazy people that have no responsibilities. And it couldn't be further from the truth. We know from the data that more than 60%, about 63% of the uninsured in North Carolina are already working. And as Senator Corbin mentioned, a large proportion of them are women, and a lot of times women with children. Mm-hmm. So one of the first things that we had to do is we had to use data to correct the misinformation that was out there. And then the second thing that we needed to do is we needed to humanize the data, because there was a dehumanizing narrative that was already out there. And so one of the things that we did, for example, when I would talk to folks, I would talk about the story of Albert Hartline. Albert Hartline was a dear friend of mine that I graduated high school with in 1989. And in 2006, he was inducted into the Jackson County Hall of Fame because he was the first high school wrestler to win a state championship in the history of the Jackson County schools. Mm-hmm. And unfortunately, Albert Hartline spent his whole life working in the construction industry. He didn't have insurance, and he spent all of his discretionary income buying rental properties so that he would have retirement, and so that he would have something to leave his son, and so that he'd have a source of income when he could no longer do construction. Well, unfortunately, when Albert was about 50 years old, he, as Senator Corbin mentioned, eventually went to an emergency room because he didn't have the insurance. Went to an emergency room, received a terminal diagnosis of cancer, and then his life spiraled out of control.
Mm-hmm.
In the subsequent 8 months, he was admitted 9 times on a 72-hour hold for his mental and emotional distress. And then his life concluded after he shot his neighbor and shot himself as a result of just this horrible despair. He was a victim of facing the disaster of bankruptcy as a result of not having health insurance. And he was a hard worker with an adult child.
Mm-hmm. Right, right. I'm gonna toss it to Chris Cooper now, because one of the things, like when you spend time in the legislative building, you hear these tropes that like stories make a difference for Democrats, ROI makes a difference for Republicans. They really want to see the numbers, right? Chris, talk about this idea of like how you can marry those and maybe humanizing the data.
I think Casey just gave us a great illustration, right? I mean, he talks about very well about putting a story to the data. And I think there's two pieces of that, right? You need both data and you need the story. And the data is the basis of it. Look, there's a whole lot of differences between Democrats and Republicans. Find me a Republican who drives a Subaru, right? You may not be able to find one, but I think on this, Democrats and Republicans are very similar, right? In this way, they both respond to stories. They both respond to data. I would push back gently and kindly against the notion that Democrats are anti-data, or excuse me, Democrats are anti-data and Republicans are anti-story. I think you really do see both. And I think Senator Corbin talks really well about how this in some ways is a conservative policy. By this, I mean Medicaid expansion. So just looking nationally for a second, states that have decided to expand and states that haven't. Lots of different ways to think about what's a conservative state and a liberal state. Won't get into those, but I think we'd all buy like Trump vote share would be a reasonable one, right? If Trump gets a higher percentage of the vote, more conservative state, lower percentage of the vote, less conservative state. Well, using that metric, the 6 most conservative states in our country all have voted for Medicaid expansion. So that's a policy issue that really doesn't have to be conservatives don't like it, liberals do, Republicans don't like it, Democrats do. I think the data actually shows something different. And as we look at the conversation in the General Assembly, and obviously Senator Corbin is going to be, know the weeds of this much better than I do, but from the semi-outside looking in, it does show the strength of party that the Republicans in the Senate have decided, and let's be honest, Phil Berger, have decided to get behind this. But at the same time, it shows the limits of party and a little bit of the disagreement between the House and the Senate. Because what we've got, if you're not paying attention to the weeds of this or the TikTok of this, is that the Senate is basically saying we're on board, and Tim Moore in the House is saying we're not quite so sure. And so we tend to think, oh, party rules everything. And it matters, but at the same time, I think this is a good example of the limits of party. And maybe this isn't as much of a Republican versus Democrat issue as we tend to think. And I'll sort of close with this. Those 6 states that are the most Republican in the country and that also have voted for Medicaid expansion also tend to be really, really rural states, right? We're talking about states like Wyoming, West Virginia, Oklahoma, North Dakota, Idaho. And I think it means something that we're having this conversation about Western North Carolina, a very, very rural part of the state. And so maybe it shows a little bit of the kind of difference between urban and rural, perhaps more so even than the difference between Democrat and Republican.
Well, it's interesting you say that, Chris, because before we got on the call, before everyone else got on the call, you and Casey were saying, oh, say hello to this person and that person. And even though you live miles apart, it's a smaller community where those ties, it's sort of like, maybe it's hard for an outsider to fit in, but boy, if you're from there, like, everyone kind of knows everybody.
And everybody knows everybody's story. And I think
Right.
to connect back to Casey and Senator Corbin's point before.
Right. So Senator Corbin, like, what was the reaction when you first brought this to your caucus in Raleigh?
Well, when, as you mentioned, I've spent time in local government before I was here, and I'll apologize again for my voice. I'm trying to get through this. But when I first got to the legislature, I went to the House, spent two terms in the House, representing Macon, Clay, Graham, and Cherokee County. And then Senator Davis, Jim Davis, decided he was going to retire. And he came to me and said, "Why don't you run for my Senate seat?" And I gave him a very quick answer. And my answer was no, not going to run for the Senate. I'm deputy whip in the House. I chair 2 committees. I'm moving into leadership very quickly into the House. No, I'm good. I'm staying in the House. Well, Senator Berger talked to me and said, "We really want you to run for the House," and gave me some very good political reasons. And Professor Cooper could probably expand on that a little more, but they wanted me for political reasons, felt like I was a shoe-in for the seat, and would be less money to get me elected than a known Republican, and so on and so forth. So one of the first things I said, no, I'm very happy in the House. I'm good. Why do I want to change and go back to the bottom? And so basically, Senator Berger said, "Well, you won't go back to the bottom. You won't chair a committee, but basically we will view you as time served in the House, and you'll say, you have respect in the building," was his words, "and that respect will transfer over." And I said, "Okay, let's talk about one other thing. Let's talk about Medicaid expansion." So I talked to Senator Berger 2 years ago about Medicaid expansion one-on-one. And I will share with you that he was not negative about that. He was very, he listened to what I had to say. I told him all the things we've said here this morning. And he said, I'm open to that conversation. We'll have to bring a lot of our colleagues along. So one of the things that is kind of a misunderstanding is among Republicans is, okay, we're Republicans, so we're against Medicaid expansion. That's another government giveaway. It doesn't make sense. I'm a Republican, so I'm a no on Medicaid expansion. Thank you. Let's talk about the next thing. Well, that's not looking at the whole picture. It's not looking at the whole story. Let's talk about all of it, which we've done this morning. So we began to do that. That began to happen in the Senate. After I got there, I'm not just saying just me, but other folks were very instrumental in that. And so long story short, we wound up not only introducing Medicaid expansion, and Senator Berger did ask me to take the lead as far as one of the folks, myself, Senator Bergen from Harnett County, Senator Krawick, they're both health chairs, and Senator Britt from Lumberton, North Carolina. So the 4 of us basically took the lead on that, put our names out there, did the press conference, said we're going to do it. And the vote wound up being almost unanimous. We had 2 no votes, two no votes. And one of those was a guy that had just heard all the conversations and just said, you know what, I campaigned on the fact that I wouldn't expand Medicaid, and so I'm going to vote no. And I respect that. That's an honorable reason for a vote. Even though we may not understand that, we may not agree with, that was the reason for the no vote. And I think the other no vote was just no, philosophically was against expanding Medicaid, and that's okay too. But the point is, you went from a North Carolina Senate that on the outside was no way,
monolithically no. Mm-hmm.
No, not gonna do it. Just don't even talk about something else. To the fact that we passed that with 2 no votes, 2.
Mm-hmm.
So that's a quick story, but it's been a couple of years in the coming.
Right. We're almost at 9. I do want to remind folks that we're a not-for-profit news organization, hosting these types of conversations here in North Carolina. Your support is incredibly important to us. So would encourage you to please consider a donation. We'll put the donate link into the chat. I'm going to throw this, and if it's okay with you, gentlemen, we'll stay. We usually try and cut off right around 9:05. If you can stay for a little while and sort of dig into this, and I'm going to throw this open. how do we, so for people who are trying to work through a thorny policy issue, what are the lessons for other folks who want to get to yes, to create good public policy that can extend across political lines? How do we do that? Anyone want to try? Chris, you want to maybe?
Sure. Yeah, I'm happy to talk a little bit about some things that I think have worked well and some things that I think aren't working so well that I'm witnessing with this. One, and look, this is obvious, everybody knows this, but finding points of commonality. So I just read a report about January 6th, completely unrelated topic, right? But I think some of it still works. And it was about how to move people on that issue. And the key was reminding them of patriotism, right? Reminding them of issues that we all agree about. And so I think that's part of it, right? You move from a place of agreement into a place where you're trying to move their opinion, right? You don't lead in with the thing that you disagree about, right? So what are the symbolic issues where you're closer, where you two are already close together, and then you work through it. So that's, I think, something to do in general. And obviously I want to hear what the other folks have to say. But one thing that I'll say that has disturbed me a little bit, Senator Berger has at least publicly changed on this. And I loved the story from Senator Corbett about kind of how that happened. But one thing that's worried me and disturbed me is when I've seen some folks on the left kind of pop at Senator Berger about his change, right? Calling him a flip-flopper, saying they don't agree with it, or they don't believe it, saying that there must be something else happening here. And I think you've got to give people space to change their minds. And I think when there is this negative reaction to people changing their minds, it makes it a lot harder for the next person to change, whether that is Tim Moore or somebody else who really matters in the House. So part of it is, I think, how you act after that change is public.
No, that's a great point. What qualities do you think made you the right messenger, Casey, to help people get to yes?
So I don't know, Rose. If I had to speculate, I would think that it helps to be really empathetic and compassionate. And when you're empathetic and compassionate, and you're having a conversation with someone who has a differing opinion, your natural instinct is to be very honoring of that opinion, to honor it, to acknowledge it, and then move the conversation from breakdown into flow. And then once you can move the conversation in an honoring way from breakdown into flow, then you can begin to share data and information and hopefully influence a person's mental model about something. And that's exactly what we did. We were very honoring of the opposition because we know that elected officials, especially in rural North Carolina, these are folks that unquestionably are committed to the well-being of their people. Nobody's getting rich being a local elected official. I can tell you that. And they have a lot of stress and worry that they wouldn't have if they didn't put on all that responsibility. So if we assume generous intent, and if we are honoring and respectful of differing opinions, then hopefully we can build a relationship and share meaningful data that will get us to a new position. And then like Chris Cooper said, we have to be very, very honoring of that. And we have to allow people to have the space to change their minds and to accept new data. If we make it embarrassing or humiliating to accept new data, we just entrench.
Right. It makes me think, Senator Corbin, that it's that quality of relationship, right, that helps to move the needle. How did that play out for you? I mean, how did you seen that play out for you?
Sure. I think, and go back to what Chris said about Senator Berger, saying that he flip-flopped or that he was disingenuous for some reason is very unfair. I know the man very well. And I've had the conversation with him 2 years ago, again, when he was trying to say, hey, Kevin, we want you in the North Carolina Senate. And I said no. And we had the conversation about Medicaid expansion. And he told me then, yeah, I'm open to that. I've been a no. I think it's a waste of government money. It's inefficient. One thing we haven't talked about, I'm going to drop in real quick, you didn't ask about this, was Medicaid transformation. So something happened is Medicaid transformation. So one thing that I think is fair that we definitely do look at the bottom line. We look at what's it going to cost. How efficient is the expenditure of that money? What's the return on investment? All those questions. Well, everybody in my camp, Republican camp, felt like Medicaid was inefficient, spending a lot of money, running over budget, spending more money that we didn't have, et cetera, et cetera. Well, with Medicaid transformation, very quickly, I don't want to dive too deep into the weeds with this, but for those that don't know, instead of the government handling those Medicaid dollars the way it's done now, because we voted for, we put into place Medicaid expansion in the last year. It's just happened in the last, really gone into effect in the last 7-8 months, is Medicaid transformation. To what that is, you take those government dollars and now you let private insurance companies, Blue Cross Blue Shield, WellCare, there's 6 companies across the state that administer that manage that. It's managed care. So the example of that is Medicare Advantage plans, which again, I deal with. I'm in that world. I understand it. So Medicare Advantage is where those government dollars are given to private insurance companies. It costs about $800 a month, roughly speaking, $800 a month to have someone on Medicare. So the government takes that money, they give it to the private insurance company. Here's the $800. Now you take care of Ann, you take care of Chris, you take care of Casey. Those are your $800. So what do? They're going to say, hey, Ann, have you had your annual checkup? Chris, have you had your annual exam, your blood work, all that? They manage the care. They try to make sure the person gets their health care. Why? Because it's more efficient. It's more cost effective. To me, that's a conservative approach. It makes, as a Republican, as a conservative, to do that. So we did that. We did Medicaid now, back to Medicaid. Medicaid transformation is doing kind of the same thing with Medicaid dollars, letting private insurance companies administer those, which is more efficient than the government doing it. Yes, it is. And it's proven to be that way. So that was a big driver in helping some of my Republican colleagues. Hey, this is not throwing bad money down a bad hole. This is improving a system that we already have. And this is insuring people that haven't been insured before for all the reasons I said before. I won't go back into that, but that's very quick.
And I will say that, our Medicaid transformation, our Medicaid managed care program has gotten national kudos. I mean, it's been really well written and includes this pilot project to address some of the social determinants of health, those things like lack of transportation or poor housing, jobs that really contribute to people's health, right? There's a recognition of that. So it's a really interesting, believe me, we've been watchdogging it to see and it doesn't seem to be going off the rails at all. So we'll keep watching that because that's what we do here at North Carolina Health News. We're watchdogs of what's happening. And it's really interesting. Just this morning, I saw a piece that was just published in JAMA, in the Journal of the American Medical Association, that states, there's a comment here in the chat about mental health services. And it turns out that states that expanded, everyone over the past couple of years has seen an increase in suicide rates, but in states that expanded, that increase was less than in states that didn't expand. So, and the people who were most affected were men in the 20 to 29 range. They were the ones who saw the biggest delta in suicide rates and gained the biggest benefit from Medicaid expansion, because these are some of these folks, they're young, they're starting their career, they don't have a lot of money, so maybe they can't afford health insurance, but maybe they could be in an expanded Medicaid program. So, do we have any other questions from our audience? Or what are sort of your takeaways now from where should we take this? A lot of folks that we've had 2 or 3 folks saying, how do we move the House? How do people move the House? We've got 100 and some people sitting on this call. How do they help their House representatives get to yes?
Who's that question for, Ann?
Okay.
Rose, I'll take a stab at that. And
All
then
right, Casey.
obviously I defer to Senator Corbin, who'd be the expert on it. But my initial reaction on how to get to yes is to contact your local representative and tell them, we understand, and now's the time. We understand that we appreciate fiscal conservatism, but now is the time. We have a guarantee of the 10% federal match into perpetuity because of the amendments to the Social Security Act. We've got 1.7 billion in incentive payments if we expand. We have the hospitals and the health systems on board with assessments to cover the state's 10% match, and Medicaid transformation, as Senator Corbin mentioned, has launched. It's successful. So now's the time, and go forth and represent us and give them cover. Let them know it is safe now to make this decision.
Mm-hmm. Senator Corbin, you had some thoughts?
Well, yeah, I'm not going to talk forever about that. I think Casey's exactly right. You let your representative know it's okay to support Medicaid expansion. You're not the devil if you do that, if you're a conservative. And let me point out something politically, and Chris could address this better than myself, but I came out for Medicaid expansion 2 years ago, right? That's not been a secret. And I had a wonderful lady ran against me in the primary for Senate, and she ran probably to the right of me a little bit on some issues, and headlines in the newspapers, and still are this past couple of weeks still, but headlines in the paper: Corbin favors Medicaid expansion. I got almost 80% of the vote in the primary. So either that was a popular stance, or people didn't care. One way or the other, it didn't matter. The fact is, it did not hurt me. And still, this past week to 2 weeks since we did the press conference, came out with vote, and obviously I stood on the floor and argued for this. We got 2 no votes out of the entire Senate. Headlines all over the state, and especially in my district: Corbin favors Medicaid expansion. Senate passes Medicaid expansion. You know how many negative comments I've gotten? I'll be very honest. How many negative comments I've gotten?
I'm
2.
curious.
My fingers, 2. And those 2 people were people that I had respect for, that said, hey, their comment was basically, I thought Republicans didn't want to expand Medicaid. Thank you for the question. And I spent some time answering exactly like I've answered this morning, explained it to them. And you know what their response was? Oh, okay, we understand. So I've gotten 2 negative responses. I answered both of those. And after answering those, they were both, oh, thank you. We appreciate your explanation. I think one of them probably still didn't agree with me, but was thankful for my explanation. The other one said, yeah, I agree. That's a good decision. So politically, I think it's a wise decision, and we just need to let our House counterparts know that. Believe me, I'm talking to them every day about that alone, but go ahead.
And, maybe we'll give the political scientists the last word, Chris. Like, is there a takeaway lesson, a larger takeaway lesson from this example?
Yes, we're a polarized nation. Yes, we're a polarized state, but sometimes the issues we think we're polarized are not actually the ones that show the most polarization. I mean, I think obviously Senator Corbin I think he would say, he can correct me, he's a good conservative, and this is a policy that he supports, and that is not antithetical to his ideology at all. So I think the lesson is really, let's not use the polarized environment as an excuse to not act. I think the other lesson, Casey talks really well, better than I ever can, about the combination of data and stories and kind of how that works. I think you can't just have stories and you can't just have data. I think that's critical. And again, I think for the folks on the call on the right, I think it's about contacting your legislators and saying, hey, it's okay, kind of giving them the freedom. And for the folks on the left, I do think sometimes it's tamping down the rhetoric. I mean, I know I said it, but I am a little bit disturbed to watch what people are saying about Senator Berger and this decision. I think we need to learn to take people at their word, and I think we need to give people permission to at least publicly change their mind as information changes. The other party is not the enemy. The other party are people that have deeply held beliefs, and it's about trying to get to some sort of compromise position. So because those are my final words.
Well, and I told this quip when we practiced that, a friend of mine, when he first arrived at the legislature 20 years ago, when it was all Democrats, said, to one of the old wags, why don't they agree? They're all Democrats. And he said, the other party is the opposition, the other chamber is the enemy. So sometimes it's that difference between the two chambers and their priorities. So, but this has been a great conversation. I appreciate the fact that you folks have stuck around and, taken some questions and like really chewed through this topic. And, I think where I come from is that, we really want to just see good health policy that benefits the most patients, right? And so I think that this has been a great conversation to help people understand how to get to yes, that it doesn't involve name calling, and it involves persuasion and data and relationship. And it's and we exist in relationship. So and trust, right? And building trust across the aisle. So I want to thank all three of our guests, Casey Cooper from the Cherokee Health System, Chris Cooper from Western Carolina University, and Senator Kevin Corbin from Western North Carolina, from 6 counties. And I really appreciate your time this morning. I know all of you are very busy gentlemen, and I really appreciate you taking the time to join us today. So thank you. And for those of you who are on the call, want to just remind you one more time, North Carolina Health News, we are your source for health information in North Carolina. Please consider donating to us. We run on donations and on the donations from foundations across the state, from sponsors. If you're part of an organization that would consider sponsoring North Carolina Health News, and of course your individual donations. So thank you so much. And one of the people in the chat just said, please get a COVID test, Senator.
I will. Thank you. I'm going to urge you to hang up. So thank you.
All right. Thank you very much,
God bless.
gentlemen. Have a good day. Thanks to everyone for joining us.